collaborations work because we respect and support each other. And it's a key aspect of collaboration, of mentorship, of any of the interactions we have. Mentorship is a human influence. It can be, but only if you're open to it. Is such an important aspect to success, is just being able to just believe in who you are and what you're doing.
Hello, everyone. Welcome back to OncoDaily. And today on OncoInfluencers, we have Professor Daniel George from Duke University. Thank you very much, Dan, for having the time for us. Thank you for being our guest.
My pleasure. Thanks for having me.
Thank you very much. Recently, I was interviewing Lorelei Mucci, and when I asked who should I interview next, without any hesitation, she mentioned your name. Why?
Well, for several reasons. Lorelei and I have been friends and collaborators for the past decade, and it's been a real pleasure to work with her. She's an amazing epidemiologist in cancer, and we have shared interests. I am a medical oncologist in genitourinary cancers, specifically in kidney cancer, and I have interests in new drug development, in cancer disparities, and real-world evidence. And over this last decade, we have worked together to form and implement an international registry for men with advanced prostate cancer. And it's dovetailed some of my interests with hers, and it's been a real learning experience and I think hopefully a great resource for others to study as well.
Why did you choose medicine and oncology?
That's a good question. I think medicine kind of chose me. I was born in Massachusetts. My grandparents were immigrants from Ireland and from Italy. And my father was the only one to go to college. And it was a big family dream to have a doctor in the family. So when I showed some aptitude to sciences, they immediately said, "You're going to be the doctor." And I guess I didn't know any better but to say yes and follow that path. Later, as I got closer into applying to medical school, I started to realize it was a good fit for me. I enjoyed and loved the sciences, but really the application. And that's what medicine really is. And it is, data-based. And oncology in particular, to me, was sort of a golden opportunity at the time. It was a field where there was the beginnings of a lot of areas: precision medicine, imaging, targeted therapies, immunotherapy, and gene therapies were still very much in kind of the dream state. But I will say that I saw the future of oncology as being one where I could maybe make a small contribution, and that excited me. And in the course of it, I've also fallen in love with taking care of cancer patients and just the reward that we get from the interactions of patients who are vulnerable regardless of their circumstances, and very appreciative of the care we give them, and that has also been a real joy for me.
I'm going to cite you. We grow and we develop our trust with patients because of who we are as people and how much expertise and care we bring to each case, right? It's your words.
Absolutely. Absolutely. Trust is something you earn. There's no degree or accolade that bestows trust. It's personal. And to me, it's our responsibility to build that and maintain that with our patients. It's also something we do with each other, our colleagues. Collaborations work because we respect and support each other. And it's a key aspect of collaboration, of mentorship, of any of the interactions we have. So to me, having people that I trust, people that I respect, and people who respect me is really a key tenet to scientific collaboration and work.
So coming to the next question, then, what's the most important in oncology, in your opinion?
I think first and foremost is integrity. This is a field where there is a lot of skepticism. and probably rightfully so. We give very dangerous medicines to people, and there is huge profits in the margins with many of these, novel medicines. That it's really important that we have the utmost integrity in the care and the use and the development of what we do, and we have a lot of potentials for conflicts of interest and whatnot. And it's just so important that we value our integrity and our peer recognition in our field. And no matter how successful you are, you can't maintain that unless you have those two criteria. So those are the most important.
Going back to your career, can you explore a bit more, like medical school, and then starting from the medical school, please? I'm sure it's going to be very interesting.
Yeah. Well, I went to Duke University as an undergraduate. Again, I grew up in Massachusetts, and I was fortunate enough to go to a private school for my middle school and high school years. I grew up in a large family of five. We didn't have a lot of resources, so I had scholarships and financial aid to help. And my parents helped put me through, but I also acquired some debt along the way. I went to Duke Medical School. I had an opportunity to go to University of Massachusetts on a full scholarship, but I really loved Duke as an undergraduate. It really exposed me to medicine. I got to do research, and I really wanted to stay. It's a beautiful place to live and to study. And so even though it was much more expensive, I stayed on to medical school at Duke, and at the time wasn't really sure what field I would go into. And in my second year of medical school, I was on a rotation for surgery with 17 of us, 15 of whom knew they wanted to be surgeons. And me and one other person were unsure. And I remember one experience I had with the chair of surgery sitting in his conference room and him asking the question around a pig lab that we had all done. And everybody had said their experiment went fine. When he came to me, I told him that my pig died when we operated. And all my classmates were snickering, like you can't say that to the chair, but it's the truth. And he looked at me and he said, "Well, what happened?" And I told him we were doing a splenectomy, and I had a clamp on the splenic artery, and I cut too close to the clamp, and the clamp slid off, and the artery just sucked right back up into the spleen, and the pig bled to death. We couldn't find it. We couldn't get it out. He looked at me and said, "You learned a valuable lesson, didn't you?" And I said, "Yeah, don't cut too close to the clamp." And he said, "That's exactly right." And he absolutely, favored me the rest of the rotation and gave me honors and interviewed me and asked me to go into surgery because I had that integrity and willing to say the truth. And it was, of course, I didn't really want to go into surgery at the end of the day. It was too much pressure, and I wasn't in love with operating, so it wasn't for me. But it was still very, very flattering to have a chair surgery, ask you to go into this field. But I went into internal medicine, and I think, originally was going to do cardiology. I'd verbally committed to cardiology. I was at Johns Hopkins at the time, and I loved the CCU and all the measurements and all the, interventions that we could do on people. But I did a small 6-week rotation elective in oncology, and I worked in a prostate cancer lab with Jonathan Simons and Bill Nelson. They were two young assistant professors at the time, and I worked with Mike Carducci and another colleague of ours in urology, Joel Nelson, and we worked on this small project around endothelin. And it just absolutely encapsulated just engrossed me. And we could take a protein that was a vasoconstrictor, and we could study it in cancer and how we could kind of change that by targeting that biology, change the cancer. And we were the first to describe this biology in prostate cancer. And we actually wrote a clinical trial. And just that process of going from the lab to a phase 1 clinical trial, I was hooked. I was like, I have to do oncology. This is a field that I can, we can make a difference in, and I can take things from the laboratory into the clinic, and how exciting is that? So I decommitted to cardiology and applied to oncology, and they had a spot for me at Hopkins, and I stayed there and went into GU oncology and prostate cancer, and the rest is history.
You mentioned several times about the mentors and mentorship. What's the most important in mentorship?
When it comes to mentorship, it is also really personal. And to me, the most important thing with a mentor is just somebody who you trust. And you trust them because they're a good person and they're willing to take the time to help and support you. And as a mentee, the most important thing from a mentee is kind of the same thing. What I look for is somebody who is eager, who wants to learn, who, is committed to learning and coming into our field and learning from it, but is somebody who is open to influence. When I interview people, the main question I ask people is, who has been the biggest influence on your life and your career? Because influence is really something that we're all subject to, but we don't always recognize it. And being able to recognize who has really influenced your career, shaped your career, made the fundamental changes and forks in the road that have defined kind of who you are and where you are is so important, that kind of insight. So I love to hear that from people. And for me, mentorship is a huge influence. It can be, but only if you're open to it. So many people, it's a transactional relationship, and that is not influence, right? That is, a service and a deliverable. But there's so much more to mentorship than in being a mentee than just the transactions of a paper or a project or what have you.
What would be your answer to that question?
I figured you were going to do that. So I think the number one influence in my life has been my parents. And I know that sounds cliche, but that's not always the case. But I think in my case, both my parents in different ways were strong influences on me, both to pursue, a career and everything, but more essential than that, to have confidence. And confidence, not arrogance. Have humility, but believe in yourself. And that, is such an important aspect to success, is just being able to just believe in who you are and what you're doing. And that really comes from, a deep sense of love, that you are loved, and that you, because of who you are, and that you are somebody that can achieve. That really comes from your parents. So, or should come from your parents traditionally. So to me, that was probably the first and most important influence. And then I would say, in medical school, those interactions with Jonathan Simons and Bill Nelson and Mike Carducci really shaped my career trajectory, that yes, oncology is where I want to go, and in particular prostate cancer. And then, that team that followed, Jonathan, John Isaacs and others were really crucial to my career development. Last most important career person was Phil Kantoff at Dana-Farber when I took my first faculty position. And he really taught me how to be a clinical investigator and to do and study, and also to talk with patients. So that, that was really a huge, kind of influence on me. So that's the other aspect of this that, was really, important to me. And then I think the last huge influence is my wife in the background here, but who has really, enabled me to be the academic oncologist that I am, the father that I am and husband, and has been sort of my, steadfast support and partner through all this. So those have been, the influences that have really kind of shaped me over these years.
And who are your mentees?
Yeah, so I have a number of mentees over the years. And, I initially worked with fellows when I was a junior faculty at Dana-Farber, but there were so many senior faculty to me that they probably wouldn't identify me as their mentor. I didn't really get to be a mentor until I came to Duke. And at that point in time, my most successful mentee is really my colleague and, and partner now at Duke, Andy Armstrong. And I recruited him from Johns Hopkins as a fellow and gave him some of the first, projects and papers we had here at Duke. And now over 20 years, I've just seen his career, just grow tremendously. And he's just an amazing researcher, amazing clinician, amazing collaborator, and really good person. And I've, just enjoyed, working with him and seeing his career take off and stepping aside and just watching that, him grow. Probably the next, mentee that right from the beginning I had a lot of influence with and very proud of is Tian Zhang, who was a resident fellow with us at Duke, and was originally going to go into GI oncology, but we convinced her to do GU, and I was able to work with her on some early projects in kidney and bladder cancer, and she just was an amazing, mentee, and being able to quickly synthesize issues and problems, to operationalize trials and to write. And she is now very much an independent investigator at UT Southwestern and is an international rising star, particularly in kidney cancer, and still a dear friend and, collaborator and colleague. I've had a number of folks here at Duke, Michael Harrison, over the many years now, from his, recruitment from Wisconsin to Duke, and have just been able to see his career grow in different approaches, both in real world evidence and some of the registries in kidney cancer that we do, but also in exercise and survivorship. And he's taught me a lot through, the work we've done together in that space as well. So it's been a great collaboration. And then there's just a number, many, many fellows that have gone through, that have gone into other places or other, careers in medicine and oncology that I had an opportunity to work with for a few years, but have since moved on. And to me, it's always a joy. Whatever people choose for a path, whether they stay in our field in academics or go elsewhere, just the ability to influence them for a short period of time, even, is very rewarding. And to me, it's something I try to do with every faculty member we have here, but also with as many residents and fellows as I can, even if it's just for a brief period of time.
Thank you very much. Can you explore a bit more about the most significant moments and the hardest moments in your career?
Gevorg, I've been pretty blessed, I got to tell you. I was able to access some amazing, academic institutions through my career, and have not had a lot of rejections in terms of not being able to go to medical school or to an undergraduate school, top school, and whatnot. But as I've progressed in my career, I've learned to deal with rejections, and the rejections are important to learn from. I learned, mostly from applying early for Young Investigator Awards. And I did have a prostate cancer foundation, what was Capture back then, a Young Investigator Award. But I never had an ASCO award. And although I applied, But it's a fantastic organization. I've done a lot of volunteer work with them, but I learned from it. And I learned that, these, rejections are not personal. And it was very hard for me. And I've had since many grants rejected, and I had two ASCO abstracts rejected this week. Published online, but not the same. And I realized that from being on the other side on these review committees, that we have to reject most of the work that we review, and it's not personal, right? But it should be constructive. It should be critical. And sometimes you don't get any feedback. Sometimes you do. But the point is be able to go back and look at the work and see what you can do better with it. And this was a really important lesson for me to learn. It creates for me humility. It's the most important aspect as an oncologist is humility. I mean, aside from the integrity and everything, because what humility does is it grounds you in asking things that you're missing. What am I missing? And rejection keeps that humility so that you can keep asking the questions, what am I missing? What is it? And it's true when you're taking care of a patient, or if you're going to give a patient a therapy, you feel, oh, this is going to work. Nothing works 100%. And so having the humility to be able to say, why didn't that work? What are we missing? These are really important traits as oncologists, whether you're a scientist in the lab or whether you're a clinician in practice. We need to be thinking about what are we missing? How do we do things better? So these are sort of, I won't say any one particular event, but they're skills and I would say obstacles that I've learned to deal with and overcome in my career. And I still, I'm a very positive person. I try to make a positive out of everything that happens. And it's really important, that we learn from our failures. That's the most, kind of critical thing about that, so that you're not destined to repeat it. And I have found success, sometimes in areas I didn't expect, but it's because we've asked questions that either others aren't asking, or in a different way, or in a very effective way. And that's so important. And it's not as easy as it sounds. It really does take a long iterative process. So for me, those have been the biggest, the biggest challenges to learn and develop.
What would be your advice to younger generation? I mean, that was already, I mean, you gave so many advices, for example, about the rejections. I'm sure like these days, so many people are discouraged about their rejections, especially the ASCO period of the abstracts. But in general, what would be your advice? You have other advice?
Yes. So for young people coming into this field, this is, I'm going to say an uncertain time. But when I went into oncology, it was a very uncertain time because we had very little therapies to offer people. It was fairly depressing to talk to cancer patients when you don't have any effective therapies to offer. And it's one thing if people have gone through a number of treatments and responded and eventually failed. It's another thing if they're coming in the door and all we have to talk about is prognosis, and we can try this and this, but they haven't really changed the outcomes in patients. That is a very difficult time to practice. And so every generation has their challenges, and this generation is no different. There are going to be challenges with uncertainties around funding, around where are the clinical opportunities, where are the research opportunities, how can I carve out a niche in a field that's so developed already. And what I will tell you is that even though we think that our fields in cancer are developed, we will look back 10, 20 years from now and laugh at how rudimentary we are in our care. So this generation, I'm very excited for. This is still the best time to go into cancer. And I'd still believe our best years are ahead of us. And that, the ability to really be more precise in how we diagnose, how we stratify and prognosticate and patients and their disease, and then how we target precisely therapies, how we develop not just one drug after another, but combinations and sequences and approaches, not waiting for disease progression like we so often do based on our current clinical trial paradigms. I encourage young people to challenge the dogmas that we have today. There's so many dogmas that prostate cancer patients have to have hormonal therapy, that we treat with hormonal therapy indefinitely, that, testosterone, we can never give that back. Therapies don't combine together. Or, how can we integrate, approaches when we already have a standard of care? How do we build on it? Is it always 2, 3, 4, 5 drugs, or can we think of other ways of approaching therapy in diagnostics of minimal residual disease? So there's so many more tools. There's so many more questions. I think there's more opportunity than ever in this field. What we need to be is open-minded. We need to challenge, dogmas, and we need to measure. And as long as you can do those things, then, you'll be successful in the field wherever it takes you. So I encourage people to, think boldly, be focused, think boldly, and don't fear rejection.
Thank you. What if not medicine?
I was at an advisory board one time, and they went around the room and asked, what would you be if you weren't, an oncologist? And I said I would be a pharmaceutical marketer. But all kidding aside, I don't really know what I would be if I weren't a physician. And I say that because as an undergraduate, my major was Latin and biology. And so I'm not sure what you can do with a Latin degree. I guess I could have been a priest, but probably would have been a terrible priest. So I'm not really sure. I never really entertained another career. And some people go into medicine, then they go off into business, or they go off into industry or other careers, politics, or all kind. And I guess I've never really seriously thought about doing anything but being a doctor, being an academic physician, and being a clinical researcher. So I it's hard for me to imagine myself in other things, but I do think I have a pretty good communication skill. So I think, probably something where I was, kind of dealing with the public in some way. So maybe I would be a salesman. I don't know.
What's the painting behind it?
Yes. So this is a painting from North Carolina, Western North Carolina artist, and he is Joel Turner, and this is called Fences, and it is based on out there some stone walls, and this was one of the original colonies, North Carolina, and there are many of these lands and farms that were divided by just stones that they dug up and created these small boundaries, and so this is called Fences. These are some of the earth tones in the ground here, and then above this, just the beautiful skies and sunrise or sunset, whichever you choose around this. But what's really I love about art is that different people can look at the same painting and see something totally different. And we see this in medicine. We can look at the same study, and I can say, that's a really positive study. That's a clinically significant effect, and I'm going to treat patients with that. And other people can look at the same data and say, I'm not convinced. Nope. That's not that there could be other factors, and I need to understand that patient population better, and that's an intermediate endpoint. It's not the final endpoint, and or the toxicity is too great to justify the clinical effect, and I'm not going to use that therapy. So, we bring a lot to our interpretation of the outside world, and even things as objective as science is open to interpretation. But I love art because I think it is, a wonderful way of. I don't have a skill set in it, so I appreciate other people's skill set, and it's a wonderful way of seeing the world and seeing how we interpret the world. And it tells a lot about the artist, but it tells even more about yourself when you look at art.
If you describe you in one sentence yourself, how would you describe?
Insufferable optimist, empathetic, and self-deprecating humorist who enjoys people and is one of the luckiest, men alive.
Can you tell a little bit about your family?
I grew up in a family of five. I have three sisters and a brother, and we had modest means growing up, but it was a household, full of activity. I am the fourth out of five children. There's no books written on the fourth child, so there's very little documentation of what that actually means. But I'm the quiet one in my family. A boisterous group of siblings and parents. I met my wife when I was in medical school, and she was in graduate school at UNC, and she has a PhD in English. And we fell in love and married 18 months later, 2 years later, somewhere around there. So we've been married for 30, coming up on 31 years. We have two beautiful daughters, amazing daughters, very different from each other. They're both in graduate school. One's in getting a master's in social work, and the other's getting a PhD in quantum physics. And they love North Carolina. They both grew up here and went to school at Duke. And we've, been really, really happy living in this area. We enjoy travel, and we've traveled, the world with our children early on, and still do. And it's one of our shared values as a family. We also enjoy cooking and lots of home cooked meals and conversations around the dinner table, and we enjoy activities, from tennis to pickleball. I enjoy swimming. I can't get anybody else into it, but it's one of my real joys in life as well. And music and dancing. And I would say those are the things that, really kind of define us as a family, and it's the values we have and that I like to share, even if I'm not very good at any of them. They're still things I enjoy doing.
Thank you so much, Dan. Thanks for the wonderful interview. Just the last question,
Yep.
which I am asking, who we should interview next?
Yes. So, tell me, what are you looking for in an interviewee?
Someone like you, interesting, accomplished, that people could learn.
Yes. So,
In oncology, connection to oncology, of course.
yeah. So, there's a couple of people that come to mind. One is, he might be hard for you to get, but he's a friend of mine who is an interesting person, has a very different lifestyle, but I'm sure a wealth of knowledge to share. Tom Powles. I don't know if you've interviewed Tom Powles before.
No, I haven't. I haven't had a chance.
Yeah. So Tom's hard to pin down, but he's a great storyteller.
He write him that you recommended, so
absolutely. No, absolutely. You can write to him, CC me, tell him, that you interviewed me and that, I recommended him. I think another really good person at this point in their career, that I think, would give you some great insights in the field, and just kind of life perspectives as well. Is I don't know if you can get him right now. He's our ASCA president, Eric Small, but he was also a mentor of mine.
Oh, Eric is a mentor for me as well, and I had the chance to interview him in the
You did have Eric.
Yes.
Fantastic. Yeah, Eric, was part
It
of
was wonderful. I love him a lot.
Yeah, and another guy that
And I think I have his book on my, we were on just a moment, we were on the leadership development program with ASCO, and he gave us this book.
See, you were there. That's awesome.
I just sent him a photo 2 days ago because I took the photo of this book in the airport. I said, I think they learned from you and putting these books in the airports.
That's very cool. That's really cool. Let me think. I'm sure Lorelai probably mentioned Phil. Would you be interested in somebody who was in academics and then went into industry?
Yeah, why not? Of course.
Okay. He's an interesting guy. He's a friend of mine. I think he's the chief medical officer now of Veracyte, and his name's Phil Febbo.
I would just need your introduction.
Absolutely, yeah. I can sort of like what Lorelai did. I can write a little intro, and see if he'll find some time to talk with you. But he's a wonderful guy. He's a brilliant guy. He's really, really talented. And I did not peg him for industry, but he's done a great job there. And so he will kind of tell you sort of like, the oncologist view from the industry side. And I think could be really, really enlightening as well. Lots of other, have you interviewed Chuck Ryan?
No.
Okay. Chuck is a great guy. He's written some books too. And Chuck has done a lot of different things, and he's currently at Memorial Sloan Kettering and is, I think, putting together kind of almost like a private equity group for drug development in cancer, and so he was CEO of the Prostate Cancer Foundation for a couple years. He's been a chief of medical oncology in Minnesota, was at UCSF. He's kind of been all around and is an interesting guy as well. A really good, a really good interviewer. So Chuck Ryan would be another one as well.
Thank you so much. Thanks you so much. And I really enjoyed the interview.
Yeah.
Thank you very much.
Don't forget to like, comment, share, and subscribe to OncoDaily on YouTube. Hit the bell icon to stay updated.